Okay. All right, so welcome to neuropathology. Try to make it as painless as possible. Although the nervous system is quite complicated and we have a limited amount of time to cover everything. Before we get started, we do have a very special guest here today, all the way in the back from Baltimore, Maryland. Give it up for Mr. Dr. Ihms. He is actually the owner of one of our case reports that we're going to be going through today. So you guys are really good. Maybe he'll come down and you can ask him some questions. If he's really good, maybe I'll let him. All right, so disclaimer here. I'm going to try to focus in lecture on things like terminology, like we did in Gen Math, on like big picture, general principles, responses to injury. I'm going to hit a couple species-specific diseases, but it's going to be things that are like common to a bunch of species. Again, very broad general principles. For the more nitty-gritty stuff, you're going to have to read on your own. So Zachary and Gavin, TBVD is a really good resource. That's the required textbook anyway. So check that out. A lot of the stuff we're going to be talking about will be applicable to those species-specific diseases. So hopefully you'll be able to use the principle we talk about in the lecture and read through those diseases and be like, oh yeah, that makes sense. It's the pattern we talked about. Any questions, obviously ask me anytime. Lecture lab, my office. So this I also stole from Sean Spagnoli. The brain is an infinitely complex organic parallel processor that generates consciousness from an interplay of chemical, mechanical, and electrical signals. Right? We know the brain is the most important organ in the body because the brain tells us this. However, the paradoxes of the brain is that despite doing all this really crazily complex stuff, managing, not just our unconscious functions, but also our consciousness, it is also essentially a squishy jello sponge wedged into a bone jar. So functionally, there's a lot there, but structurally, you're dealing with basically a giant soft wad of fat. So it doesn't offer a lot of resistance to things like trauma, mass effects, stuff like that. So that's kind of the paradox of the nervous system. Quick review, normal CNS anatomy, you have a skeleton, which protects your nervous system. Brain and spinal cord. Meninges, mater means mother. So these are the three mothers, or the meninges. You have the tough mother, which is the dura, the very grossly visible, thick outer covering. The arachnoid or spider, which is kind of this like web-like connection between the dura and the pia. And then the pia means faithful. So the pia mater is the one that's essentially just hugging against the brain. Very difficult for the brain. Good mothers. Functionally, we kind of group these. We refer to these as the pachymeninges and the leptomeninges. So pachy, does anybody know what pachy means? What's a pachyderm? Thick. Yeah, thick or tough. The tough meninges and the more delicate meninges are arachnoid. So this is what you'll hear more commonly. Gray matter. It's gray because it's mostly cell bodies, primarily neurons with their supporting cells, which include microglia. Remember, these are the resident macrophages of the brain, and astrocytes, which have many jobs in the brain, primarily forming the blood-brain barrier and performing ion exchange. They also produce a lot of cytokines that do a lot of maintenance in the brain. And then the white matter, it's white because it's mostly these long axons of the neurons that have their cell bodies in the gray matter, and then mostly myelin. So oligos are the main glial cells here, and these are the guys that produce the CNS myelin. All right, so again, we have neurons. Remember, they're a big cell body and then a super long axon. These are the longest cells in the body. And a neuron that has its cell body in the gray matter in the spinal cord can send an axon all the way down to like the limb, right? So these are very, very big cells. I'll say this probably several times, but a neuron can survive an insult to the axon. It can lose part of its axon and be okay. But if you injure the cell body, that's like the brain of the cell, so you can't recover from that. But injured axons you can recover from, thankfully, because they're so long and we frequently injure them with the things we do to them. Astrocytes, here they are forming the blood-brain barrier. So they wrap around, this is a blood vessel here, and these astrocyte foot processes wrap around the blood vessel and form an extra layer for that blood-brain barrier. Microglia, again, these are macrophages. They have little processes, so they're doing immune surveillance in the brain. And then oligos form CNS myelin, so here they are wrapping around axons and forming myelin sheath. All right, important lingo. You guys know I love defining words. So here are the core words that you need to know for this unit. It's red and starred, very important. Will be on the exam. You must know this for life. So we make morphologic diagnoses by combining these terms. So who wants to tell me what leukoencephalomalacia means? Necrosis, white matter, brain. Yes, those are the three components. Good. And then poliomyelomalacia. Necrosis, gray matter, spinal cord. And then meningoencephalitis. Inflammation of the brain and the meninges. Easy, right? All right, a little less easy. Neuroanatomic localization. This is critically important when you're submitting an animal for autopsy. Very, very frequently, all the time. Almost all of my neuro cases come with this history. History of neurologic signs. I'm this guy. I have no idea what that means, right? The nervous system is very big. It could be anywhere. You know, do you want me to look at the brain? Do you need me to open the spinal cord? Do I have to look at the muscles? Like, tell me where to look. So neuroanatomic localization, super important. And that's this principle that the clinical signs that an animal is showing us guide us to a functional system that is disturbed. And we know that functional system is located in a specific anatomic location. So, example, what is the clinical sign that these pigs are displaying? Head tilt. What's the functional system that it points to? Vestibular system. So what is the anatomic location of the vestibular system? Ear or brain stem. Good. So then you have to do some additional test to figure out, is this central or peripheral disease? And you would do that thusly. Just an example. All right, so here's the cheat sheet. I'm not going to go over this. This is just for your reference. We will use this several times in the coming lectures. And here's the one for spinal cord. All right, so this is Jake, his owner, Dr. Ihms. Would you like to come up and answer questions about Jake? Yeah, man, why not? All right, so give this a read. You don't need a mic, you're fine. That was on my shoulder. So yeah, tell us what happened to Jake. You woke up, found him in the morning.
Yes. So yes, I woke up, found him in the morning. He had actually been acting a little weird the day before, sort of walking around. I was pretty young at the time, but like it was clear that something was up with him. And I don't know, but yes, okay, yeah, she put that in there. And it progressed really rapidly the next day, to the point at which by a little bit after noon, maybe 2 or 3, like he was just laying down. We actually had to load him into the truck to get him to Purdue, University of Purdue. But and well, I don't.
No, it's okay. It's just history.
Yeah, and
don't tell them what's the problem.
Yeah, I'm not gonna
obviously.
Yeah.
That's a secret.
But I will say one of the things that left a very large impression upon 13-year-old me was when we actually got him into the wheelbarrow. Like one whole side of his face was totally unresponsive. Like eye was just open and staring. I remember like trying to get him to blink. That was really freaking me out. And the other side was okay, maybe delayed, but like one whole side is totally.
Any questions? Pretty good history. Yeah, we got some questions.
Do you have any plants around your property that someone to the right, what they are?
So yeah, so that was kind of one of my, there was two things that I was kind of concerned about. One was we actually had him pastured under an oak tree. And I had heard that oak leaves, like I never saw him eating any acorns, but I heard that oak leaves could be potentially a little toxic. But I was really more concerned about some of the silage that a friend of ours had dropped off. We had
Other question? Yeah.
Which way is he circling? Which direction was
the left was the left side of his face that seemed to be. If I remember correctly, it's been a while.
for any of them?
No, but he was the only one that was like hide out in this particular area.
What was the silent stuff, or what was it?
Mostly just corn, like corn that someone had picked out of. Yeah.
It says that you had been to a couple different 4-H shows. Did any of the other 4-H participants of those shows see any similar signs for their goats?
And it was a
Hairy
pretty,
monkey.
it was a pretty close knit community. Like we would have heard there had been other problems.
Goat people in Indiana are very tight.
Yeah.
For a while, but like when this batch, like a new batch that would just like put out.
Good questions. Anybody else? Okay, what do you want to do next? Thank you, Dr. Ames.
Came all the way to Indiana just to give that.
He's been waiting all these years.
It was a really good, really.
Oh, I guess he's really good. Okay. Yeah. What do you guys want to do next? Neuro exam. Hooray. All right, so here's your neuro exam. When you first approach him, he's standing in the corner of the stall. His head is pushed against the wall, and he doesn't really seem to notice you. You kind of tap him gently on the back to get his attention, and he doesn't really respond. He's pretty quiet. He seems kind of out of it, not really aware of his surroundings. The right ear, sorry, you remembered incorrectly. It was the right side. The right ear, eyelid, and lip are droopy compared to his left side. His pupillary light responses are normal, but he has an absent menace on both sides, and his palpebral reflexes are weak to absent, especially on the right side. He seems to constantly want to turn his head to kind of look over his right side. There's no evidence of cervical or spinal pain. You check range of motion, everything seems fine. You put him on a lead to try to get him to do a gait analysis, but he refuses to walk in a straight line, and he instead forms these really big circles to the right. And while he's circling, he often kind of stumbles a little bit and kind of misplaces his left front foot. So where is Jake's lesion? Is it focal or multifocal? Multifocal. All right, so location 1, central vestibular. Why? The head pressing. So what is head pressing? So head pressing is a clinical sign. What would be the symptom? Pain. Yeah, that's a headache. So that's usually a cortical sign, often, right? Sure. Me. All right, so we maybe got some central vestibular. We've maybe got some brain. Anywhere else?
Seems like your cranial nerves 5, 7, and 8 are definitely affected. All 3 of them.
Definitely. Where
And
does
it
that put
seems
the
like
lesion?
unilateral, because the other one's a little bit.
Good. It's unilateral. We've got lateralizing signs. So which side is the lesion on? Who thinks it's on the right? Who thinks it's on the left? So we're pretty split. Who thinks it's on both sides? Nobody. Well, maybe. So it is multifocal, right? It could be on both sides. Let's see what we have here. Circling. Do we usually circle towards or away from the lesion? It depends. What does it depend on? It's vestibular or not cerebellar, cortical, right? Circling, and what else? So there's a sign in here that does not fit with vestibular. I didn't tell you about it saying this, but he doesn't have a head. He does have a head tilt picture. Don't look at the picture. But he has a head. He has a head turn. Right. So a tilt is this way. A turn is I'm trying to look, and that's cortical. That's brain. I've got a brain lesion. So the circles and the turn are both cortical. But he also has some central vestibular. He's got brainstem signs. He's got cranial nerve deficits. Good. And then what about this foot? Speak up. Somebody who knows, raise their hand and yell. I think it's proprioceptive deficits on the left side. Is it? There's different kinds of proprioceptive deficits, right? What are they? Types of ataxia. Paresis. What's paresis mean? Weakness versus paralysis. Can't move. There's proprioceptive ataxia, right? There's cerebellar ataxia. What is ataxia? I don't know where my legs are. Okay, good. So we have what kind of deficits? What kind of ataxia? Proprioceptive ataxia, right? All right, so we said it's multifocal. We decided it was brain and brainstem primarily, right? Oh, this other checklist looks good. He doesn't have cerebellar signs, right? Doesn't have hypermetria. Spinal cord, it's okay. Yeah. Peripheral nerves. All right, so we'll come back to Jake. His mystery illness will remain a mystery for now.